Hello, hello. So, did you know that cancer is the second leading cause of death? You probably know what the first leading cause of death is because I've talked about and talked about and talked about, and we talked about like the heart diseases. But second in line are our cancers. And today, the cancer that we're going to talk about is one of the ones that's in the top five. Now, I know you're probably thinking about breast cancer and prostate cancer and lung cancer and all that stuff, but it is March, and March is colon cancer awareness. So we're going to talk about colon cancer because it is one of those cancers that is actually preventable. In fact, 9 out of 10 people who have their cancers found early are still alive 5 years later. So that's a big deal. So it lets me know that if we do the things and put them in place, then we can really get this under control or even prevent it. So that's what we're going to do today. We are going to talk about the basics of colon cancer. We're going to talk about like what is it? What does it look like? The symptoms, the risk factors, and of course how to prevent it. So thank you so much for watching and welcome. I am Dr. Ashley Booth. I'm a board certified family medicine physician, and I'm also the owner of Healing Beyond the Stethoscope Primary Care, where I provide practical health tips and tools that you can use in your everyday life. Because what I understand is that life eventually will affect your health. So before we get into it, just do the thing, show some love, share it, let people know that we are talking about it. Also, you can put on that notification so you don't forget and subscribe and leave some comments. Let me know, like, does this make sense for you? Are there some other questions that you have about this or anything else that we are talking about? So let's go ahead and get into it. Colon cancer. One of the things is it really made the news when Chadwick Boseman was diagnosed, right? Like everybody was like, no, not Wakanda forever, right? Like what happened? Chadwick had it, and that's when everybody started to understand what was going on. Because years ago, Katie Couric came out and talked about her husband and how he had it, how he passed away. But Chadwick really like took it to another level. A lot of people are like, oh my gosh, like this can happen to someone so young. And that is true. But the thing I want to tell you is that it's not just affecting celebrities. Like that's what we hear and that's what we know. But it has come to my own doorstep. I've had some family members and some friends who have been diagnosed with it. So I have seen it up close and personal. And I'm going to tell you this, I actually did some more talking with my family about it. Was like, hey, just asking the family history and stuff, and found out that it is a lot more prevalent in my family than I realized. So we're going to talk about that too, like how we need to get the history and the information because it is a lot more prevalent. It is a lot more out there. But like I said, if it is found early, and like I said, those 9 out of 10 people who found it early were still alive 5 years later. So that means that this is something that we can definitely get control of. So, what the heck is colon cancer in the first place, right? So, what is the colon? And it actually is colorectal cancer, but they just shorten it and say colon cancer. The colon is like a lot of people say the bowels or your large intestines. That's what it is. And what happens is there's just a little outpouching, so you have your tube and you have your bowels. You have a little bit of growth that keeps growing. That's what cancer cells do. They just grow and they do what they want, how they want, when they want. And those little cells continue to grow and they become polyps. And they can either be precancerous or they can become cancerous. So that's what this is. That's what the colon cancer is. And some of the symptoms that you will start to notice is you might have some weight loss, but you're not trying to lose it. So that's what we call unintentional weight loss. So you're losing weight, you haven't changed your diet really, and you're like, I'm just starting to lose a lot of weight. Or you feel really tired. I'm just like tired and I can't explain why I feel tired. You have some changes in your bowel habits. You all of a sudden become constipated. You usually are regular. You go every day like clockwork. But then that's not happening anymore. And you've had a long spell of just constipation. Or you have a lot of diarrhea. Or it starts flip flopping. I have constipation, now I have diarrhea, now I have constipation. So your bowels are all over the place. The color of your stool is kind of all over the place. So it's just changing on you. You can have some abdominal pain, your stomach hurts, and then you have some crampy pain, and you just can't, something's not making sense. It doesn't make sense. So you can have some abdominal pain. The other one and the big one that a lot of people talk about is rectal bleeding. So you can have some blood that starts to come out. When you have that, that is a I must see someone like yesterday. You have some of these other symptoms, definitely you need to talk to your doctor about it. But if you are starting to have some bleeding from the rectal area, you definitely need to have a conversation with your doctor, because is it polyps? Is it hemorrhoids? Like, what's going on? And we need to put the full picture together. The thing is, people always say, well, what are my risk factors? What puts me at risk for this in the first place? Well, one of the big ones is if you have some of what we call inflammatory bowel diseases. So if you have Crohn's disease or ulcerative colitis, I know those are big words, but if you have it, you know that you have it. And that starts to put you at risk. If you have obesity, unfortunately, if you are overweight, that can put you at risk. Smoking for sure. And then a family history. If you have a family history of a sibling or a parent that had it, that increases your risk. So all of those things can affect you. Then we want to talk about like prevention, because if we know that we have these risk factors and we know what's going on, then how do we prevent it in the first place, right? Well, diet. I know we talk about this a lot, but I can't stress it enough for everything across the board. Diet is very important. And to keep your bowels going and moving the way that they should, then that's like lots of fruits and vegetables, lots of fiber, because you really want to keep things going and moving. You want it, one of the things they say is like a decrease or low animal fat. So, really fatty foods, you want to kind of stay away from that or decrease that. Becoming active, if you get active, a lot of times that's also going to help with the weight. So it's going to give you 2 for 1 with that. And then screening. We have to screen for it, because if you start having symptoms, then that tells me something else is already going on. But if we screen and we start looking for it, we can start seeing where is the problem and how do we get rid of it in the early stage. This is how these 9 out of 10 people are still alive 5 years later, because we do this early screening, which means that we are doing it before you have any symptoms, right? And the two main screenings that I'm going to talk about today is one, colonoscopy. A lot of people are not a huge fan of colonoscopies, but it's okay. Let me tell you the benefits of it. And let's just talk about what a colonoscopy is, okay? A colonoscopy is they take a camera and they go up. Now, before they do anything with this camera, you are asleep. So they do what they call general anesthesia. You have a little twilight sleep. Someone told me that if I just led with that first, and they said, listen, you just told me that I'd get a good nap, then hey, I would have signed up for this a long time ago. So you would get a good nap and they are going to put you asleep. And then they're going to take the camera up and they're going to look in all of your bowels, and they're going to look and see, do you have any polyps there? Those polyps that I told you about that can either be precancerous or cancerous. If they see them, then they're going to remove them. They're going to take them out. So that's good, because now it's no longer in there. But then they're also going to send it for pathology. And that just mainly means going to a lab. They're going to look at it under the microscope and say, is this precancerous or is this cancerous? And then they will go from there. So that is a good way to not only get screened, but also to remove what is in there. Now, depending on what they find, determines how often you go. So some people may be on a 3-year plan, a 5-year plan, or a 10-year plan, but it can vary depending on what they find, your family history, all of that kind of stuff. Now, the one thing that people do not like about the colonoscopy is the prep, because you do have to poop all day. And the reason why is you have to clean it out. So then when they put the camera in there, they can see everything that they need to see. And that prep looks one or two different ways. Either you drink some fluid, you drink it for a period of time, and it's going to help you clean out. Or you take some pills, you drink a lot of water, and then those pills will help get everything moving and you clean out. Either way, you're going to clean out for a day. Then the next day, you're going to do your procedure. The procedure itself lasts maybe 10 minutes. Like them actually putting the camera in, looking around, seeing what they see, and taking it back out is about 10 minutes. Doesn't take that long. Now, that whole process itself of you actually going and doing the pre-op stuff, and it's going to call pre-op, even though you don't feel like it's a surgery, but for you to do your registration, and get signed in and all that stuff and get ready and then come out and wake up. All of that is probably about 2 hours or so. But the actual time of them doing it is very, very quick. Okay. So that's your colonoscopy. And then the second one that I want to talk about, and that's like the number one gold, what we call gold standard. You get a gold star for doing that because again, they can look in and actually see what is going on. And while they are in there, they can take whatever they need to take out. Okay. So that's the number one thing. But there's some people say, well, either I don't have time for a colonoscopy, I don't want to do a colonoscopy, whatever. What else do you got? Right. So the next thing that we have is the Cologuard. And the Cologuard is basically just your stool. So your poop. And you're just sending a sample of that in. And what it does is it looks at the DNA from those cells that are in your poop. And it is trying to test any precancerous or cancerous cells that come off of the polyps. So if you have any polyps, those can shed some cells, and those cells can likely show up in your poop. And then when they test it, they'll see if you have any of that stuff in there. If they do see anything and it comes back positive, then you got to go back and you got to do the colonoscopy. If not, you're fine. With that, there's a lot of people like it because there's no prep. Whenever you have to go poop, that's when you submit your sample. You do it in the privacy of your own home. Then you pack it up, you send it to the lab. The lab will look at it and then they send you back the results. So that's usually it. But this is only for people who are at average risk. Okay. Like if you have a family history of colon cancer, if you have a personal history of colon cancer, if you have any of those other things that I talked about, like Crohn's disease, ulcerative colitis, that's probably not, is not recommended for that. So if your risk is average, just like everybody else, then you can do the Cologuard. Now, with both of these, you need a doctor's either a referral because you're either going to go to the GI doctor to do your colonoscopy, or you're going to need a prescription. So you can't just, call up the Cologuard people and say, hey, I want a Cologuard. You have to get that prescription from your doctor. So you want to make sure you do that. And screenings for everyone starts at age 45. So whether you're doing your colonoscopy or your Cologuard, it's going to start at age 45, and you can do them all the way up to age 75. After age 75, that's when you have to start having a talk with your doctor, because 75 might be your last one, because they may say, oh, you're not due for 5 years or 10 years. But then you start having to talk with your doctor and say, okay, if I live longer than 5 years, am I a good candidate to do it again? So you just have that conversation. But typically starts at 45 and goes up to age 75. And the one other thing I wanted to mention about Cologuard is every 3 years. So like what I said with the colonoscopy, depending on how well it looks, you can do 3, 5, or 10 years. With your Cologuard, it's every 3. So with all of this, this is the main thing that I want for you to take away from this today. Have that talk with your family, because like I said, I just found out that I have a whole lot more in my family tree in regards to colon cancer than I realized. And that was just by having one conversation and say, oh, well, I thought they had X. And it's like, no, they actually had this, and then so and so had it, and so and so. So then you got to have those conversations, start talking to people and get clear about what they had, because you may think they had one thing, but in actuality, they had something else. So you want to talk to the family members about that. And then to prevent it, do all the things that I talked about, like decreasing your risk factors, increasing your diet and those veggies and fruits and fiber and all that good stuff. So to make sure that everything is running on a regular schedule. But then you also want to do your screenings. And with your screenings, you want to make sure that you also follow up with them. And you can kind of like forget sometimes. So you want to get with somebody who's going to help you remember when you're supposed to do these different tests, sit down and explain them to you, talk to you about like when's the next time and why that looks that way, all of that. So you want to talk to your GI doctor, but also partner with your primary, because your primary is going to see you more often than that GI doctor. They're going to have it on file. They're going to look at it and they're going to say, hey, you're going to be due next year. Let's get ready to put in that order so that you can make sure that you have it. But you want to make sure that you do that, because that's what primaries do. That's what I do. So if you're still looking for a primary to kind of help you figure out, okay, when should I do my colonoscopy? When should I do my other things? Then definitely look us up because we're still accepting new patients. You can go to our website and look at our website, but you can also go there and enroll. You can also give us a call. The number is on the screen. Or you can make sure that you partner with your primary doctor because at the end of the day, my goal is that you are well and that you are getting all of the things that you need. So until next time, I will see you soon and take care.